This is part 2 of a 2-part series of male fertility with Dr. Jason Kovac. In part 1, we covered hormone optimization, testosterone replacement therapy, endogenous and exogenous. We also talked about men's health in general. In this part of the episode, we're going to be talking more specifically on the male vasectomy, outcomes, expectations, and who is a good candidate. Next question is, let's talk about, so in my practice, we do a lot of women's health. And, you came in, I showed you around, kind of showed you the lay of the land. So we do a lot of women's health. We do a lot of hormone optimization, testosterone replacement therapy. And a lot of times these poor ladies come in and they're on oral contraceptive pills, which when you're on an oral contraceptive pill, if you're a patient, you're listening, when you're taking that, it will increase something called sex hormone binding globulin. When you have a high sex hormone binding globulin, it's going to bind up that testosterone. And so then as the female, your testosterone is going to be low. And so I always say there's nothing worse than an unmatched couple. If we've got the guy optimized and the woman is not, this is recipe for a disaster, in my opinion. So I often have this conversation with my female patient. Have you and your spouse or your significant other talked about another method for birth control? And so then, the vasectomy, right? And so it's almost like you mention the word, almost like if you mention a word of estrogen to women, it's almost like they have a visceral response where they cover their boobs. When you say the word vasectomy to a guy, it's like they cover their groin. And it's like, I just said the word. It's not like I was going towards you with a scalpel. Calm down. And so can we talk a little bit about that? So can you talk us through, the length of the procedure time. So I was actually with my husband when he got his vasectomy. I mean, it looked very, very just, I don't want to say cut and dry, literally, no pun intended. It was very cut and dry. He sat on some peas for a couple days and then he was like back golfing like the next week. So it was very easy to do.
Well, it's nice that you sat on the peas as well. It shows support.
So can you kind of talk us through a little bit of what that process looks like, please?
Yeah, vasectomy is a great form of sterilization. It's simple, it's easy, it's quick. The testicles are outside of the body. It's not something I think that men need to be afraid of, but I realize that it's because I do it and I see testicles all the time, and I'm just we're used to handling the testicles, right? I'm used to handling the scrotum. So a lot of guys are like, whoa, don't touch my thing, don't touch my boys. Like, I don't want anyone going anywhere near there with like either a scalpel or like some sharp object. So I understand that, but usually it's not something to be afraid of. So typically, typically what you're going to look at is you're going to walk in, and we're going to, the way I do it is, after informed consent and all this kind of stuff and talking about the risks, which we can talk about later. But typically they'll come into the room, they'll lay down. I will give them a cord block, which basically numbs the entire inside and lets you do whatever you need to do. Honestly, I could do a lot to somebody with a good cord block. So I give them a good cord block. I let that settle in. And then really that's the most kind of painful part of the whole procedure. It's like a little pinch and a burn, takes like a second, and then that's it. And then basically we drape them all up. I feel the vas deferens. You can feel the vas deferens very easily if you've felt millions of them. So you feel it, and then you just kind of isolate that vas deferens. Now there's different ways that you can get to the vas deferens. So you could use like it's no scalpel approach, and then you basically identify the vas, open it up, and then kind of take a segment, burn it, tie it off. There's a lot of different ways to sever the tube's connection. So different people will do different ways to do it. And there's no one way that's right, whether you tie it or you clip it or burn it. There's all kinds of different ways. But essentially, you're disrupting that tube. So you're blocking the flow. Then you put it back, give them a little bit more local. They put on a jock strap, and away you go. Typically takes about 15 to 20 minutes. So it's quick, it's easy, it should be pain-free as long as you have that proper numbing.
Yeah.
I usually do them on a Thursday or a Friday. The guys take it easy over the weekend. Pain-wise, you're looking at about a 2 to 4 out of 10. So it's not horrible. I do ask them not to do any heavy lifting, nothing more than 10 pounds for about 2 weeks. No ejaculating for about a week. And the key thing is they're not sterile until they've done a post-vasectomy analysis, until we've looked at their ejaculate after their vasectomy and said, and sort of blessed them, hey, look, you've got no sperm.
Yeah.
Now, the other thing is that it's not immediate. So you can't have the vasectomy and then a week later be like, I'm good to go. Because you're still going to have stuff in the pipes.
Right.
So you got to clear that stuff out. So usually I'll tell them about 10 to 20 ejaculations over the course of about 6 to 8 weeks. And then come in, do the analysis, confirm that you have 0. And then you're good to go.
Okay. Perfect. Recovery time, you said like 2 weeks. I mean, I feel like my husband was back at work like Monday, Tuesday. I don't feel like he was off very long.
Yeah. So, I mean, you'll probably have the sense that you've done something. So he'll sense that maybe a 1 or 2 out of 10, kind of like a dull little ache for 2 weeks afterwards, right? It's not anything that's going to limit activities. Most people will go back to work like on the Monday. If you do it on a Thursday, Friday, they'll go back to work on the Monday, as long as they're not working construction and things like that, right? But, usually you're fine even to go back to work that same day or the next day. So it's not something that, is dramatically painful. I'd rather say a pain level of 3 to 4 out of 10, so that when it's less, they feel a whole lot better. Right. And usually that's the case. A lot of guys will go back to work the same day, the next day. I don't even give them, honestly, I don't give them any narcotics afterwards, usually Tylenol, ibuprofen, and ice. And that's really all that.
That's perfect. Perfect. Okay. Let's say guy had a vasectomy, got divorced. Oh shit, now I'm remarried. Now this young vixen wants to have children. They're presenting in your office. Dr. Kovac, can you help us? What do you do?
Yeah, so there's a couple of, first I ask him if he's on testosterone or not. And then once we've sorted out that little issue, then you kind of, what are the options for conception after vasectomy? And there's really 2, right? So you can have either a vasectomy reversal, or you can do in vitro fertilization. One question I do get a lot of is, can I do intrauterine insemination, which is where the reproductive endocrinologist would take sperm that's been ejaculated out, run it through a filter, and then inject it into the wife. You can't do that if you've had a vasectomy. So, the only ways you can do it is either IVF or vas reversal. There's a huge cost difference between the two. So a vasectomy reversal, usually around $7,000 to $8,000, including the facility fee, the surgery fee, and the anesthesia fee. IVF, you're looking at about $25,000 to $30,000, with the female having to undergo medications and us having to get the sperm out. So if you do elect to do IVF, then usually you're looking at getting the sperm out either with a needle or an opening. If you elect to do a vasectomy reversal, then you're looking at about a 2 to 2.5 hour surgery, where you would have an opening probably around an inch or so, on less than an inch on each side of your scrotum. So it's obviously more in depth than the vasectomy, right? 15-minute procedure where you're able to go back to work the same day or the next day, versus a 2.5 hour surgery where you sit around for 3 days, ice off and on, not because of the pain, but just because I usually phrase it as I want my masterpiece to remain perfect during the healing phase, right? So you're kind of looking at that period of time, no ejaculating for a couple of weeks. But usually what I'll say to guys is, from a success rate point of view, if you had your vasectomy less than 5 years ago, you're looking at about a 98 to 99% chance of me being able to get sperm into your ejaculate. So it's a very high chance of success. Now, whenever we talk about vasectomies, it's permanent sterilization. But realistically, could I repair that? Most likely, yes.
Yeah. I have 2 friends who you've actually successfully done that with. So I knew it was possible.
Thank you. Yeah. So it's definitely possible. And part of that is also questioning, right? When you're trying to decide on where and which way to kind of help the patient go. If the female is 25, is a young vixen, as you say, right? So you got this young vixen, 21 years old, she's got a lot of fertility left. So in that case, the vasectomy reversal in most cases makes sense. Right. If your partner's 43, 42, not a whole lot of time left, then does it make sense to do a vas reversal, wait for some of the sperm to come back? Because sometimes it could take 3, 6, 9 months for some of that sperm to come back. In that case, IVF is a more reasonable option. Is honestly the right answer in that case. And so usually you got to make sure you present both options and discuss both options. But Yeah, and you're right. Traditional teaching with vasectomy reversals, I find, is really lacking. You understand it, but there's a lot of people out there, that'll be like, oh, hey, 10% chance of success with a vasectomy reversal. You got to do IVF. No way. It's a lot higher than that. Especially if you go to someone who does it on a regular basis, who is an expert in it and does it properly versus people who do it for a hobby and
right. Absolutely.
There's different skill levels in everything, as you know.
No, that's perfect. That's exactly what I was hoping you would say. Okay, next question is, what is the likelihood of, so you said you get your vasectomy, come back, do your semen analysis, everything's negative, you get the blessing to like proceed on. What is the likelihood of pregnancy after you had that negative semen analysis?
Oh, this is like a Royal College exam question, right? I remember you get a phone call, and now this is probably a different example than what you've talked about, but I'll get back to that in a sec. So you get a phone call, and I don't know if I'm supposed to give away what they asked me on my exam, but anyway, it doesn't matter. So you get a phone call, and you're like, patient's like, my wife's pregnant, but the guy had a vasectomy, right? What do you do? Well, that's a minefield. How do you answer that kind of a question?
Yeah.
Right.
Right.
Do you want to know the answer to that?
Yeah.
Right. So what do you do? So, I mean, that's a tough one. I would say, I would say anything's possible, and all it takes is one sperm.
Yeah. Okay.
All it takes is one. Now,
so it is possible.
I would say that. Now, if you do a semen analysis, that would be my answer. I would do a semen analysis, and I would say, see what my semen analysis shows.
Okay.
If your wife is 6 weeks pregnant and your semen analysis is 0,
you got another conversation coming.
Then you're at risk for that not being your child.
Yeah.
I'm not saying it's impossible, but that's a risk. But because typically, if you've got no sperm in your post-vasectomy analysis, you're pretty good to go on and assume you're infertile. Can you have recanalization? Can you have reconnection? Possible.
Yeah, that's what I was looking for. That's the answer I was looking for. Is it's possible to have it reconnected or grow back?
It is possible for it to reconnect. That is possible. So you could have a vasectomy, and a lot of times this scenario happens where you have a vasectomy, you don't check afterwards, and then you end up with a conception. Then you're like, well, hold on, I had a vasectomy, so I wasn't protecting. But then you go do your semen analysis, you got bajillions of sperm.
Yeah.
Well, you should have gone back.
Yeah.
Right? And it probably recanalized. So that's probably what happened. So it's possible. But I would definitely, in situations like that, if you want to know, I would suggest getting a semen analysis and finding out what your numbers actually are. And then we can engage in the debate of what it means.
Yeah.
How you would approach that type of answer.
Yeah. No kidding. That was a good one.
You're really like
just coming in with all the questions. I had a male patient that had been getting pellets with me for 2 years. And, when I do that consent, I say, listen, are you planning on having kids? No, I already have 4 of them. Okay. Is your wife on board? Yep, I know. Okay. Sign the consent. It's part of it. Like, I understand I can't conceive. He's getting pellets 2 years. I walk in one day. He goes, hey, you're full of shit. And I was like, hi, how are you? He goes, my wife's pregnant with twins. I said, okay. And I said, were you guys preventing? And he goes, well, she was on the pill. And
you never had a vasectomy, right?
No, never had a vasectomy. But he thought in his mind, oh, we've got double protection, which is a false, if you're listening and you're a male patient, that is a false assurance that you think because you're just on testosterone, you can't get your wife pregnant. That is false. He not only got his wife pregnant, he got his wife pregnant with twins. So don't blame me if that happens. You better just make sure you either wrap it up, cut it off, or do something with it. But don't blame me with that.
There's a reason that testosterone is not used as a male contraceptive because it's not like female birth control, where it's like 99.9% effective.
Yeah.
I don't know any male that will take a medication that they say is maybe around 85 to 90% effective. No one's going to take that chance. So yes, you're absolutely right.
Yeah.
Do not count on testosterone as being a male contraceptive agent, because that happens a lot.
Yeah.
You might have 0, but you might also have 9 to 10 million sperm, and you're still able to achieve a conception on testosterone.
Yeah, no, it's great. So now when I see their Christmas card, I'm like, there's all 6 of them in there. It's funny. All right, Dr. Kovac. Well, thank you so much. I just came coming at you with questions. We went a little bit off the script, but it was so good. Okay. Just had to let it flow. I definitely want to have you on again, because I want to talk about sexual wellness, in that I feel like it's another topic that is very taboo. I feel like more taboo in women than it is in men, but I feel like there's so many cool, intricate things that I know that you do and we do as well, that I'd love to have you back on as a repeat guest, because I feel like we could really dig into that as well. Where can people find you? So what's your website?
So my personal website is www.dockovacc.com, so dockovac.com. I also work with a company called Posterity Health. So you can find us at posterityhealth.com. I am located in Indiana. I am not in, I am licensed in multiple states, but I am in Indiana. I live in Carmel, Indiana, and that's where my office is. So you can go on those websites and kind of read a little bit about me and about our company. And we specialize in men's health, fertility, treatment, hormone therapy, all this kind of stuff. So that's what I do. And our office phone number is 317-912-1616. So you can always just give us a call. But we try to keep the website as up to date as possible.
Are you on social media? Are you on Instagram?
Yeah, I have an Instagram. I've posted one video to
I was going to say, there's not much on there. I know that you're off.
And I probably have to look and see what my Instagram, Lexi, that's one of the things that you do so well, and I do not do very well. Is social media. Yeah, Doc Kovac, DOCKOVAC. There's actually there's 2 videos or 2 things on there. Yeah. And I do have a Twitter, which is Doc Kovac. Okay. I don't tweet that much, but you're motivating me to get a little bit more into the social
Absolutely.
media.
You're like a ball of information. Get it, ball? I know. You're a ball. You're balls of information. We gotta spread the word.
I actually also have Ball Doc Kovac, but I
was gonna say, I thought your handle was like the Ball Doctor or something really jazzy.
I thought it was kind of fancy, but then I was like, oh, So Doc Kovac is basically the unifying website, Twitter, and Instagram thing. I will try and post a little bit more information than I do now.
It's good.
But Posterity Health is a company that I'm working with at this point.
Perfect. I will get all those tags. I'll put all your tags and socials in the podcast episode. So thank you so much. Like I said, I'd love to have you on for a second time to talk about men's sexual health, because I feel like that is a very big world out there, that there's so many great things that are now available, and that we just need to talk about them. So any final closing thoughts you've got?
No, I think we covered a lot. I appreciate what you do for the community, as well as for all your patients. It's been great getting to know you and your practice, and it's great that we have a lot of expertise here in Indiana that we can really help these guys get to where they need to be. So no, it's great. Thanks for having me on.